And we're going to be talking about magnesium and how it affects your natural foundation. That's what my classes are all about. I'm all about repairing that natural foundation. And to give you an example of what I mean, we're currently living in Mexico, but in the U.S. we own a 35-acre farm. And on that farm is a 100-year-old farmhouse. And the previous owners had started doing some leveling of the floors on the second floor. They were all slanted, and they started in the master bedroom, and that's the only one that they were able to complete, which we're grateful that that's the only one that they were able to complete, because the issue of the house is not the floors on the second floor. The issue for the house is the actual foundation. It's crumbling, and that foundation has to be repaired. And once it is repaired, the only floor in the upstairs that will be unlevel will be the master bedroom. Everything else will even out. And so that's why I like to look at our health and look at the foundation. The foundation starts with what are you eating and how are you treating yourself. I have been studying for a very long time. It took me 5.5 years to complete my doctorate, to be a doctor of natural health. And as being even a La Leche League leader and working in the birth field, I can see where there are foundational problems. A lot of us don't want to accept that that's the problem. We think that we're eating right, we're following this diet or that diet, and we assume that it's giving us everything that we need. But that's not necessarily true. If the soil is depleted of minerals, then the foods that grow in the soil are deficient in those same minerals. So we have to supplement. I used to, a couple of years ago, I used to say, oh, supplementation is completely unnecessary if you're eating correctly. But the fact of the matter is, all of the illnesses that I'm currently seeing amongst my clients are 100% affected by mineral deficiency of a wide variety. And magnesium is one, sodium bicarbonate is another, iodine is another, selenium, zinc. Nobody is deficient in calcium. I don't want you to feel like, oh, I'm calcium deficient. If anything is out of balance, it is your magnesium to calcium ratio, which if you're eating a lot of dairy products, you're consuming a lot of foods with calcium, you are unknowingly creating an even bigger magnesium deficiency if you're not focused on also consuming foods that are high in magnesium as well as supplementing with magnesium. So that's what we're going to talk about. I do have up here on this first slide is my website as well as my email address. So if I don't get to your question at the end of the class, you can send it to me through email and I can respond there. Or if you think of something afterwards, many hours, days, weeks later, feel free to contact me. And I will answer your question. It may take me a while. My responses are not quick and they are not short because my degree is not one of diagnose and prescribe. My degree is one of educating my clients. And so there's no such thing as a quick conversation with me. So minerals are basic to the constituents of all matter. Okay? Everything around you contains minerals. They are part of living tissue and they exist in their inorganic form in the earth. Approximately 4 to 5% of your current body weight is mineral matter. Okay, so if you've ever seen an urn of someone's ashes, that is the minerals that is left after they have been cremated. Most of that mineral matter is found in the skeleton. Minerals are also present in protein tissues, enzymes, blood, some vitamins, and so on and so on. They play a large role in our lives. But the incredible thing is that we don't need a whole lot of them. Okay, I'm not talking like 1,000 milligrams. Some people are that deficient, and they have to start at a higher amount. And you'll see what the recommendations are of some of the leading physicians and natural health practitioners who are recommending magnesium. And it will surprise you, but this is how deficient we are. So there are macrominerals of calcium, phosphorus, potassium, sulfur, chloride, sodium, magnesium, and silicon. So magnesium is among the macrominerals. Your macrominerals, if you know how everything is broken down in your nutrition, you have your macro nutrients, which are fats, proteins, and carbohydrates. Those are the biggest portion of what you need to have. And then in the mineral family, you have your macro and you have your micro. And magnesium is amongst the macro. So you need magnesium. Your microminerals, or we also refer to them as trace minerals, are iron, zinc, copper, cobalt, iodine, manganese, chromium, molybdenum, and selenium. Although our body can make some vitamins, which is incredible to me, there's certain vitamins that if it needs it, it's going to make it itself. We make no minerals. Our body does not have that ability. So if the mineral nutrient is not contained in the soil, it cannot be passed on to the food and therefore cannot be passed on to you. And if you are a mother in your childbearing years, that means that if you are deficient in magnesium, you cannot pass magnesium on in large quantities to any children that you are pregnant or breastfeed, bring into this world. So we have generations at this point of people who are born magnesium deficient, okay? So we have to make sure that it's not just food, but that we're supplementing. A mineral is considered essential if deficiency symptoms are seen when it is lacking in the diet, and the symptoms resolve when it is resupplied. And this is what we see with magnesium. I'm going to show you a list, and it is by no means the total list of what magnesium helps with, to give you an idea of what magnesium deficiency looks like. So magnesium is considered an essential macromineral. It's found inside chlorophyll, and Dr. Mark Serkis refers to it as the lamp of life, because it is what helps plants in their process of photosynthesis. So if you're someone who's taking chlorophyll, that is a very good thing that you're doing. That is one way to supplement and get your magnesium. Okay, also Dr. Serkis, in his book, Transdermal Magnesium Therapy, I've read a lot of books on magnesium. Dr. Serkis puts it in very plain language. And with magnesium, he gives a very clear opinion that he is upset with both the medical as well as the natural health professionals because people are overlooking the importance of this magnesium supplementation and minerals. So magnesium is the element that causes plants to be able to convert light into energy. Without magnesium, the plants can't do that, and they would die. Okay, according to Dr. Elson Haas, in his book, Staying Healthy with Nutrition, this is an awesome book. I think that every mother should read it. We are ill-prepared to feed our children and our spouses correctly because we don't learn what we need to know. It's not taught anywhere. This is a large book. If you buy the actual physical book, it's a little over 1,000 pages, but it tells you everything about every mineral, every vitamin, tells you about fats, proteins, carbohydrates, and he gives you some really great suggestions and assessment tools that you can use within your own family. This book is also now available on Kindle, so I now have both copies. Dr. Elson Haas says magnesium is involved in several hundred enzymatic reactions, many of which contribute to the production of energy and cardiovascular function. So what does magnesium do for the body? Well, it's an anti-stress mineral. If you're having adrenal fatigue, you are magnesium deficient, okay? It improves insulin sensitivity, thus lowering insulin resistance. So if you're having blood sugar problems, you are magnesium deficient. It is used as a prevention of coronary artery spasm. So your heart muscle spasms, that's called a heart attack. Okay, magnesium is responsible for helping the muscles throughout our body, all of them, to relax, to not contract and stay there. So if you have Charlie horses, if you have foot cramps, if you experience any kind of cramping or twitching as you're falling asleep, you're magnesium deficient. It's an intracellular nutrient. It aids in DNA production and function, modulates the electrical potential across cell membranes. It helps to release energy. It dilates the blood vessels. It's necessary for production and transfer of energy. I already said this one, muscle contraction and relaxation, nerve conduction, protein synthesis, many biochemical reactions such as cofactor. It's a cofactor to your enzymes. It has the ability to help red blood cells transport and use oxygen. So if you're someone who, let's say that you have already figured out, okay, I've got a cardiovascular issue, I have a circulatory issue, which is actually an oxygen issue. Now you know that it's not just an oxygen issue. It's based in magnesium deficiency. Sometimes we don't ask enough, where did this come from? How did this happen? How did this happen? How did this happen? And we need to keep going until we find the singular event. What decreases magnesium in the body? Well, a lot of us like to use soft water in the U.S. Again, I'm living in Mexico. They have no idea what soft water is. But one of the things that soft water does is it dumps a whole bunch of sodium. That's what you're using. You're using salt, and you're adding a bunch of sodium into your water. And by doing so, you're creating a sodium-magnesium imbalance. Using diuretic drugs, drinking alcohol, consuming caffeine, consuming sugar, these are also ways to decrease magnesium in your body. So just think of it. We have these little kids that are already born magnesium deficient, and then, you know, they get into the world, and somebody is going to give them sugar. We know that. Somebody's going to give them sugar. It's not necessarily mom. Moms these days are trying to avoid sugar as much as possible. The younger the child is, we want to kind of veer away from that, veer away from juices and things. But then you have grandma, and you have great-grandma, you have aunts and uncles, and you have family or friends of the family who might sneak the child a treat, okay? And one treat, don't get me wrong, one treat is not going to dump magnesium out of their system, but the body's going to require magnesium in order to process the sugar. And if there's none coming in, it cannot restore its magnesium levels. Also consuming the American diet with the additions of supplemental vitamin D and calcium. Okay, this is the things that they're adding to it. This doesn't mean, okay, we're spending time out in the sun, so we can't do that anymore. No, that's not what we're talking about. What we're talking about is when the food industry places these synthetic supplements into the food supply. Okay, dietary phosphorus, refined or processed carbohydrate foods. Again, your body requires magnesium to process out these things. What decreases magnesium in our food? Well, we already talked about one, a magnesium deficient soil, the processing and refining of foods, the making of oil from magnesium-rich nuts and seeds. That actual process allows magnesium to go away. It evaporates. Nearly 85% of the magnesium that's found in grains is lost during the milling process. We also lose it when we soak and boil foods. The vegetables, such as spinach and chard, that have oxalic acid in them, as well as phytic acid in some grains, These may form a soluble salt with magnesium and pull magnesium out of the system before it has a chance to be absorbed at the cellular level. So, what does magnesium do for a pregnancy? Magnesium sulfate is used intravenously to prevent hypertensive crisis or seizures associated with toxemia of pregnancy. Okay, so we already have one clue. We've learned that magnesium can be used to lower the blood pressure, okay, so that a woman does not experience the hypertension and the seizures that can come about by toxemia. It plays a crucial role in fertility, pregnancy, and in early newborn life, and many of the problems associated with pregnancy and birth can be resolved by magnesium supplementation. When I teach childbirth classes, one of the things that I recommend to my students is magnesium supplementation. I have way too many women coming to me complaining about leg cramps at night or restless leg syndrome. These are magnesium deficiency, and there's a number of different things that you can do. I'm going to first let you know here in a few minutes what the first thing that I have people do, and then what some alternatives are. In 1991, Dr. Jean Durlach, she gave this statement. She said, primary magnesium deficiency may occur in fertile women. Gestational magnesium deficiency is able to induce maternal, fetal, and pediatric consequences that might last throughout life. Experimental studies of gestational magnesium deficiency show that magnesium deficiency during pregnancy may have marked effects on the processes of parturition, which is birth, and of post-uterine involution, so when the uterus shrinks back down. It may interfere with fetal growth and development from teratogenic effects to morbidity. So she gives the example of hematological effects and disturbances in temperature regulation. So we have a baby that even skin to skin with mom is struggling to maintain a nice balanced body temperature. We have magnesium deficiency there. Clinical studies on the consequences of maternal primary magnesium deficiency in women have not been sufficiently investigated. That's a problem. We need to do those studies. But we also need people like me spreading the word and saying, you need magnesium. Magnesium can stop premature labor. It can prevent seizures in women with hypertension and stop seizures of eclampsia upon onset. Magnesium relaxes muscles, and research suggests that proper levels of magnesium during pregnancy can help keep the uterus from contracting until week 35. Dropping magnesium levels at this point may start labor contractions. Okay, even Dr. Elson Haas, in his Staying Healthy with Nutrition book, has a section on pregnancy, and he talks about the need for magnesium supplementation and how important it is, especially in that third trimester. What does magnesium do for newborn babies? Magnesium deficiency or depletion is involved in the etiology of sudden infant death syndrome. Magnesium prevents hemorrhaging in the brains of infants whose mothers have a form of hypertension. Reduction of mental retardation when magnesium was provided during pregnancy. There was also seen reduced the instance of cerebral palsy in infants born weighing less than 3.3 pounds. So they did this with magnesium administered to pregnant women delivering before 32 weeks of gestation, reduced the risk of cerebral palsy by 50%. It's not a small percentage here. Also for the newborn, magnesium helps to build and repair body tissue in both the mother and the baby. Okay? So that means that as women give birth, if they tear, they need magnesium. It's going to help with that tissue repair. Okay, so magnesium deficiency is related to fatigue, anorexia, irritability, insomnia, muscle tremors and twitches, psychological changes such as apathy, apprehension, decreased learning ability, confusion, poor memory, tachycardia and other cardiovascular changes, numbness, tingling, tetany of the muscles. So tetany is when you have that Charlie horse in the middle of the night and you get up and you walk and you can't walk it off. It's staying around. If you spray some magnesium chloride oil on that muscle, it responds immediately and relaxes. It's also related to high blood pressure, kidney stones, and other tissue calcifications. I had really bad calluses on the bottom of my feet. I could not walk on hard surfaces barefoot. I had to wear shoes. Since learning this information and applying it to myself, my calluses are almost 100% gone. Okay? They are to a point now where I can walk around hard floors barefoot. I am so enjoying being able to walk around the house barefoot again. It's also, magnesium deficiency is also related to heart disease, which are caused by heart attacks due to a heart spasm. They are also linked to delirium and hallucinations. But that's not it. Hypocalcemia, low serum parathyroid hormone, low vitamin D levels, parathyroid resistance, vitamin D resistance, reduced availability of DHEA. DHEA is a master hormone in your body. It controls all the other hormones. If you're magnesium deficient, then your body cannot produce enough DHEA. If there's not enough DHEA, you have hormone imbalance. So again, it's asking that question, okay, well, I have hormone imbalance, so now let's fix it. Oh, but what caused the hormone imbalance? It's magnesium deficiency. If you're experiencing chronic inflammation, if you have an immune dysfunction, depression, rheumatoid arthritis, type 2 diabetes complications, also magnesium deficiency is related to a greater risk for certain cancers, osteoporosis, and blood cells will lack flexibility that they require in order to allow the blood cells to enter tiny capillaries. So if you're magnesium deficient, these blood cells can't make changes and they're not flexible enough. That's when they become a clot. Okay, and again, that's a short list. Magnesium is also linked to tooth enamel problems. So if you have somebody who's got a lot of cavities, you have a child who, like I had, my 8-year-old, when his teeth started coming in, they were not right. They were already brown. Something was wrong. I did not know then what I know now. What was going on was a severe magnesium deficiency that I passed on to him. Okay, so when we're remineralizing teeth, we need to have the magnesium there as well. It's not so much calcium as the need for magnesium. So natural sources of magnesium, dark green vegetables. The darker they are in that beautiful green color, the more magnesium is present. Nuts, such as almonds, pecans, cashews, and Brazil nuts, they are the highest source of magnesium. Seeds, legumes, whole grains, because your magnesium is found in the germ and the bran of wheat. So do not mill your flour, your grain down into flour, and then think that you've got plenty of magnesium there. Once you pitch the germ and the bran, your magnesium is gone. We need to go back to eating the whole wheat berry, and there's plenty of recipes out there on how to do that. It's also found in millet, brown rice, avocados, and dried apricots. Okay, magnesium is also found in spirulina. It is found in firm tofu, and I give you this because you'll find it on the list, but I do not recommend soy, simply because we already know, in case you have not already been told, that soy must be fermented in order for it to be beneficial to the human body. If it has not been fermented, the human body cannot break it down, and we struggle with that, and our body actually reacts opposite to it. So if it hasn't been fermented, it's not to be consumed by human beings. Having chili with beans, toasted wheat germ, baked halibut, Swiss chard, roasted peanuts, baked potato with the skin, and fresh spinach. So that's a pretty good list, but you can't live off of that because it's missing things like if you take meat and animal products out of your diet, you're missing zinc. So this is helping to bring in part of what you need for magnesium, okay? But the amounts found in food is not the amount that you currently need, not if you're already deficient. So you might be asking, can I overload on magnesium? Because we all already know that it is possible to have too much of even a good thing. So toxicity due to magnesium overload is almost unknown in a nutritional context. Okay, so if you're consuming foods that are high in magnesium, your body knows what to do with it because it's a familiar form, and you're not going to be able to get too much. The excesses are eliminated through urine and fecal matter. Okay, because your body knows, oh, I don't need any more of this, I'm going to send it out. Toxicity is more likely when magnesium is administered via IV. Okay. IV administration of magnesium needs to be kept to the ER room for when someone's having a heart attack, when a woman is coming in with toxemia. She needs that. Those are people who need a rapid flood of magnesium ASAP by people who know what they're doing, how much to administer and when to shut it off. Symptoms of magnesium toxicity can occur more likely if calcium intake is low. So if you're somebody who's gone off of dairy products, which are high, they're not the only source of calcium. There's calcium in every vegetable, okay? But if you're somebody who's eating a bunch of processed foods, you're not eating a lot of vegetables, you're not consuming milk or cheese or yogurt, and your calcium intake is low, you're going to have problems with magnesium. The calcium to magnesium ratio is to be 1:1 or 1:2 in favor of magnesium, okay? But it shouldn't be greater than that. Okay, contraindications. Hypothyroidism is a contraindication for magnesium. These are situations that if people came to me as a doctor of natural health with these situations, I would start someplace else. I would know that eventually we needed to get to magnesium, but I have to start repairing their foundation someplace else, okay? So hypothyroidism is one of them. Using magnesium-containing medications like antacids, laxatives, or cathartics. If someone's using those things, we're not doing magnesium. People who have colitis, gastroenteritis, or gastric dilation. Severe renal insufficiency or impaired kidney function. Okay, I have to do something to first work on those kidneys. Excessive intake. I was looking at this last night and was saying, is excessive intake of what? Well, everything, okay? We need to do things in moderation. Remember, our body uses the vitamins and minerals, the macronutrients, the micronutrients, all of those things coming in are utilized for repair during the night and for processing out the things that our body doesn't need. So if we're not doing the things to restore the grocery shelves, if you will, inside your body, then you're going to have a problem, okay? Lithium therapy, Addison's disease, familial hypocalciuric hypercalcemia, milk alkali syndrome, or depression, okay? These are all things that tell me not to start this individual with magnesium. There are some pharmaceutical drug interactions. Basically what magnesium therapy does is it allows the body to use these particular medications better, which means you would be on a lower dose. So all of the diabetes medications, if, like I said, if someone's diabetic, I know that they need magnesium, but I also know that they need sea salt and they need iodine and they need selenium and they need zinc. Okay, so there's someplace else where I can start. These medications are doxycycline, minocycline, tetracycline, hydrochloride, and then, as I said, all of the diabetic medications. So we want to be careful of those. So how do we use magnesium? Sorry, I changed phones and my kids are trying to figure out how to answer it. So how do we use magnesium? Dr. Mark Circus recommends that we do it transdermally. So we apply it to the skin. Magnesium chloride is the form of magnesium that is best. It's what the body seems to love the most. Other forms can be used, but the magnesium chloride is easiest found in the oil form, and you can make it yourself as well. It is available in oil, lotion, gel, and bath flakes. You would take the bath flakes and add a certain portion. If you're interested in knowing how to make your own, just send me an email and I'll give you more specifics. But you take a portion of the bath flakes and you add it to hot water, and you allow it to dissolve, and then that's your oil. Okay, it's actually making a salt brine. You can apply this anywhere on the body. Areas where the skin is thin are best. So the tops of your feet, the back of your hands, your armpits. You can also put it on the insides of your wrists where your blood veins are seen. They're closest to the surface, and that allows it to get into the bloodstream faster. Once it is absorbed into the skin, it will be carried where it is needed, which is one of my favorite things about the body. You don't have to make sure that you're putting it on the right location. I can put it wherever I want to, and it's going to take care of things. I had gotten to a point where I had really, really, really bad foot cramps at night. If I stretched in my sleep, I would be woken up by both of my feet just all curled up, and I couldn't do anything with them. I couldn't stretch them. I couldn't do anything. It just wasn't unlocking. And using magnesium oil, I spray it on there, I rub a little bit, and it's completely relaxed, and I don't have a problem for a few days. So for me, I'm to a point where I'm using it when I feel I need it. And I do at times have my husband or my daughter, who's a massage therapist, spray it on my back and give me a good deep tissue massage on my back. And that is a wonderful thing. And that's something that Dr. Circus talks about as well, is having a full body magnesium oil massage, which is fine unless you are a woman and you just shaved your legs. The salt brine of the magnesium chloride will burn, and it doesn't feel good. It doesn't last for long, but I like to warn people of that. You can also take magnesium chloride orally, and you do this using the oil. You add 3 to 5 or as much as 10 to 15 sprays to pure water or to juice. I would recommend doing juice. I've done water. It has a strange flavor. It's something you've never tasted before, and it can make it a little bit difficult to get it down if you're doing it in just water. But it doesn't take long for your body to respond to it. Okay? How much magnesium? Okay, so here's Dr. Circus's recommendation. He says, a sane rule of thumb for magnesium supplementation, this is not for therapeutic effects. So this isn't for somebody this isn't what you do for someone who's having a heart attack. They need to be in the ER with people who know how to use magnesium intravenously. So you're going to take 6 to 8 milligrams per kilogram of weight. Okay, so if we're talking pounds, it's 3 to 4 milligrams per pound of body weight per day. That translates into a total dietary magnesium intake of 600 to 900 milligrams. Yeah, I told you it wasn't 1,000, but it's very close. That's per day for a man who's 200 pounds, which is already above the recommended daily allowance. It's actually about double. With children, some researchers indicate that 10 milligrams per kilogram per day is appropriate because of their low body weight and increased requirements for growth. So that's more than what he's telling an adult man to take, but it's because the child is growing. They need the magnesium. The magnesium helps to strengthen the bones, especially strengthening that tooth enamel. Okay? Athletes also need more depending on their stress and training levels. I would also add that mothers need more because we're under a lot of stress these days. And we can always adjust upwards when under great emotional stress or when seriously ill. These are good dosages for oral intake, but should be augmented with strong transdermal treatment. Okay? So he's saying if you're going to take magnesium chloride internally and orally, it would be approximately 6 to 8 milligrams per kilogram of body weight. Okay? And you would still do it with, you would still apply topically. So the sources that I drew this information from is Staying Healthy with Nutrition by Elson Haas and Transdermal Magnesium Therapy by Dr. Mark Circus. Now, it's very important for you guys to understand that there are, as I said, other forms of magnesium available to us. The powder, magnesium powder, under the name of Natural Calm is magnesium citrate. I would never recommend that someone not use Natural Calms. I use it. I prepare 1 teaspoon a day and I add it to a gallon of water. And that gallon of water also contains 1 teaspoon of baking soda. And what that does is it creates an extremely alkaline water that my body loves and it thrives on. And that's what we use at dinner time. That's what everybody is pulling from in my family. So using the Natural Calm is perfectly okay, but understand this, because it goes through the digestive system, you do experience the rest, you do experience the stress reduction from it, but it's not all reaching your body at the cellular level. It will be expelled through your fecal matter. So a lot of people notice that when they are taking the magnesium citrate, that they don't have to worry about constipation. And it's the magnesium that is causing that. There's even one pediatrician who believes and teaches that most of the time a child who has extended nighttime wetting, so past the age of 5 or 6, and they're still wetting their bed, that it's actually constipation, that during the day they can respond to their bladder, which is being pressed on by constipation in the bowel. But at night when they fall asleep, they no longer are aware of that. And so the fecal matter there in the bowel is still pushing on that bladder, and they can't control it at that point because they're asleep. They're completely relaxed. So the first thing that he does is he recommends magnesium supplementation for the child to get them to a point of not diarrhea, but where they're having a consistent bowel movement daily, at least one. More than that, obviously, is better. So we have to pay close attention to what's going on in our bodies. And so, like I said, you have the magnesium citrate, and you have magnesium sulfate, which is Epsom salts. And Epsom salts are really great for the body for drawing toxins out, but what your body's responding to is the sulfur, not the magnesium. So in order to increase the magnesium stores within your body, we have to be supplementing with magnesium chloride at some point. Like I said, I'm not doing my magnesium chloride oil every single day, but I used to. And what I did was I waited until my body was giving me clear signs that it had enough magnesium. And there's times in which I just go into the bathroom and I see the magnesium chloride spray bottle there, and my body indicates that it wants some, so I give it to it. So I appreciate you coming to the class. Please let me know if you have any questions, and I'll check the chat board here in just a minute. I do not charge for these classes. I went over this in my head a very long time. I believe that the information should be available to everyone. So if you did like the class and you do feel that it has added value to your life, you can make a donation to my practice by sending a payment through PayPal to doctorofnaturalhealth@gmail.com. I'm not even going to give you a pay scale. I'm not going to say between this amount and that amount. One of the things that has always bothered me is that the information that I contain within my head and within the books on my shelves are not easily obtained by far too many, because they either don't have the money to buy the book, they're not interested in buying the book, they want someone to teach them how to do it, but they can't afford the class. So that's not going to happen anymore. So when you see my next class come up, which I'm hoping will be next week, it will be on either iodine or sodium bicarbonate. I haven't decided yet. Feel free to share it far and wide and get people in here. My goal is natural health. My goal is repairing that foundation, and you cannot fix your own natural foundation if you don't have the information that you need.